Welcome to the Pharmacist's Voice podcast, where we explore pharmacy topics and careers so you feel connected to the profession of pharmacy and inspired to contribute to it. I'm your host, Ohio pharmacist Kim Newlove. This is episode 369, and the show notes are on thepharmacistvoice.com. It is April 2026, and this is my annual Autism Awareness and Acceptance Month episode. I usually go with a solo format for this type of an episode, but this year I have a returning guest. I am joined by Dr. Brittany Hoffmann-Eubanks. In this episode, we are discussing neuroaffirming care. We're dispensing practical tips to help you better serve patients on the autism spectrum, and we're providing context to help you understand the broader ecosystem that patients on the autism spectrum and their caregivers navigate every day. Once you hear about neuroaffirming care, it just might change the way you approach all neurodiverse patients and possibly improve your relationships with them as well. As a quick aside before we get to the interview, I'd like to give a shout out to two pharmacy professionals in my life who have given neurodiversity themed talks this year already. They are Dr. Nira Kadakia and Bree Vukovic. Dr. Kadakia is a pharmacist and a professor, and Bree is a certified pharmacy tech. Dr. Kadakia and her colleague, Dr. Julie Feimster, presented Mastermind, Working with Neurodivergent Learners at the American Pharmacists Association annual meeting, or APHA as people call it. And then Bree Vukovic gave a talk at the annual meeting of the Ohio Pharmacists Association here in April 2026, and her talk was called Supporting Neurodiversity in Pharmacy Practice. I attended that one. I didn't make it to Dr. Kadakia's, but I attended Bree's, and it was excellent. If you're an Ohio pharmacist or technician and you have access to the on-demand sessions, watch Bree's neurodiversity talk. It is worth your time. The more we all talk about neurodiversity, the better. Whether we're talking about teacher-student relationships, coworker relationships, pharmacist-patient relationships, or tech-patient relationships, it's all good. I truly appreciate all the discussion about neurodiversity this spring. It's been great. Now I have two quick announcements, and then we'll start getting to the interview. First of all, I know that I have some super fans out there who listen to all of my autism awareness episodes, and I thank you. Thank you so much for listening. And you're probably expecting an update about my son, Kraig, who is now 23 and has autism. So what I'm going to do is share a very brief update, just a couple of minutes about Kraig at the end of the episode after my interview with Brittany and recapping some of our key takeaways. And my second announcement is, if you would like to explore this topic further, Autism Awareness and Acceptance Month, I have listed 6 of my previous autism-related episodes in the show notes. And I've also listed one from my other podcast, which is called the Perrysburg Podcast. And that's it for announcements. Now for a brief disclaimer. Dr. Brittany Hoffmann-Eubanks is joining us today as a pharmacist, a mom, and an advocate for her autistic child. The perspectives and experiences she shares are her own, and they do not represent her employer or any organization she's affiliated with. And now, the moment you've been waiting for, here's my conversation with Dr. Brittany Hoffmann-Eubanks. Hi, Brittany. Welcome back to the Pharmacist's Voice podcast.
Hi, Kim. It's great to be here. Thanks for having me.
It is my pleasure. It has been a couple hundred episodes since you've been on the show. It's good to have you back. And if you don't mind, I'd love to have you reintroduce yourself, please.
Thank you so much, and congrats on all of the amazing episodes. So I'm Brittany Hoffmann-Eubanks. I am a pharmacist, and I am also a mom, which is my other really, really important job. I have 2 young kids, both under 5. And one of my kids has autism. And so that is why I'm here today. And in addition to being a mom and a pharmacist, I have the pleasure and the honor of serving on the Autism Society of America's National Board as their chair-elect. And then recently, last year, was appointed to their panel of professional advisors, which was really an amazing just honor is all how I can explain that with just the amazing individuals that are on that panel of professional advisors doing wonderful work in research, policy, care of autistic individuals or people with autism, whichever you prefer. And so it's been exciting to delve into the world of autism advocacy and help try to make the world a better place for my kiddos and the entire autistic community.
Great introduction. Thank you so much. Brittany, did you say that you were appointed to that board?
Yes. Well, for the Autism Society of America, you do have to be asked and go through an official process in order to get on the board, which is pretty standard with most boards across the country. But the panel of professional advisors is something that you do have to, again, be asked to join and contribute to.
Way to represent. Way to represent pharmacy.
Thank you. It was definitely a goal of mine from the very beginning, and I thought it was just really unique that they have a panel of professional advisors. And as you can imagine, the first thing I did was look and see, is there a pharmacist on there? And so it's great to be able to bring that representation to such a wonderful group and to contribute in a different way and hopefully in a way that's meaningful because, as we know, most people, a lot of people need medications in this world. And it's great to have a medication expert.
Absolutely. I think the panel is better for having you among them.
Well, thank you. And it's one of those things where I am also just humbled because we have just some really incredible individuals that are on the panel that have been doing work in the autism space for 30 plus years or more. And truly is an honor for me to be able to serve with them and learn from them and even grow my skills in the care of autistic individuals.
Brittany, when I think back to our last interview, I looked it up. It was episode 127 of the Pharmacist Voice podcast. I had you on the show because you are a medical writer, a woman pharmacist medical writer. At this time, how do you identify as a pharmacist? Are you working on the bench? You don't have to tell me where, but are you working on the bench or are you still medical writing? It seemed like you had two full time jobs last time I talked to you. And anybody listening to this who has been raising a person with autism might think, well, gosh, I need a role model here. Is Brittany still a pharmacist? Is she still working?
Yeah, well, I don't think you ever really lose being a pharmacist, right? So I'm not in clinical practice anymore. I did leave in 2022 after having my first child. And so now my role is a little bit different. I do still have Banner and own Banner and not doing work in the business and on the business anymore. So I have a wonderful, amazing team that is taking care of all the day-to-day things that need to happen for Banner. But I do think that, you know, in terms of looking for role models or just other people out there doing things, what I would say is that the best thing that you can do is your interests, your needs, all of the things are going to change and evolve as time goes on. And so it's okay to be open to that and see where life's going to take you. Just like my advocacy work that I do now with ASA, I, you know, never imagined that I would end up on a national board ever. But as you can imagine, there were just things that happened that one thing led to another that brought me, you know, to that place. And so it's really exciting now to be able to still do pharmacy in a different way, but also, you know, kind of dig into something that's so personally meaningful for me and that I'm really passionate about.
Thank you for talking about the fact that once a pharmacist, always a pharmacist, right?
Yes, 100%.
Yep, I definitely feel the same way. Hey, this is future Kim. As I'm editing this interview, I'm realizing that I didn't follow up and ask Brittany if, even though she's not in clinical practice anymore, does she still work full time? And the answer is yes. Yes, she still does have a full time job, just not in clinical practice. And now back to the interview. I think that a lot of moms out there don't know what it means to still be a pharmacist, but then be a mom and raising a person with autism. Is there any cookie cutter way to do it? And in my perspective, the answer is no. You do you. And that's my final answer. Brittany, anything to add?
Yeah, gosh, I I don't even think that's possible, even with not being a pharmacist, right? Just being a parent and a parent of a child with autism, there's no one way. You hear frequently out there, and it really is true, where they say if you've met one person with autism, you've met one person. And I think it's just a reflection of just how different everybody is, and people in general, right? So we all have different needs, we all have different wants, different supports potentially that may need to come into play. And so I think at best, every parent is just trying to do the best that they can and to figure it out. And none of us are perfect. And so some days might go really well, and other days it might be a little bit more challenging. But I think the one consistent thing that you probably would agree with is that you keep on keeping on because there's no other option, right? In my case, my little people depend on me, and I will continue fighting every single day to figure it out and change something, do something different if I have to, or add in a new support or figure out whatever it is for them. But yes, to your point, there definitely is no cookie cutter roadmap for any of us, not even for parenthood, let alone parenting any child that has additional needs.
So, for anybody out there who's feeling overwhelmed or confused, you're probably doing it right because there's no perfect answer. It's
There is
just
not.
hard. I like to put it in this frame of mind that I am constantly kicking the can down the road, trying to make the best choices that I can that make forward progress. And every once in a while, I will try something that kicks the can off the road. I got to go into the weeds, pick it up, put it back on the road, and keep on kicking that can. So, for anybody that needs to hear it, keep kicking your can down the road.
Absolutely. And I always try to remind myself too that, feelings are temporary. I might feel really, really, like I'm having a difficult day today, but then 2 hours later, my son might do something that's just hysterical and makes, us giggle and laugh together and feel totally different, in a couple of hours. And I think one of the things that's really important as a parent is just to remember that you're doing, the best that you can, and it's okay to ask for help and to pull in whatever resources you need. But to your point, I love that analogy of kicking the can. Kind of reminds me of when I was a kid. I'm probably dating myself now of actually playing that game, but
It never goes out of style, Brittany. Never.
yeah. um, but yeah, I mean that's all that you really can do, and making sure that your kids are safe, they're healthy as they can be, and that you're providing, their basic essentials that they need to thrive, is all you really can do. And what that looks like is going to be different for everyone. But yeah, I agree. Just pick yourself back up and keep going.
Great advice. One of the opportunities that we have as pharmacist moms is that we can educate my pharmacist, pharmacy student, pharmacy technician, et cetera, audience about some new terminology that wasn't around when I went to pharmacy school, but we would like to introduce to you today. So, what is our vocabulary word of the day, Brittany?
It is neuroaffirming care.
All right, Brittany, what is that?
There are probably a number of different definitions of what neuroaffirming care is out there. And there isn't even really one set of standards or really guidelines for what that is or what it looks like, particularly for pharmacy. But I think there is an increasing awareness of the importance of it. And so, neural affirming care means that we are not going to look at someone with differences as deficient. It means that we focus on making sure that we are taking care of them in the way that they need. So, do they have the supports do they need that they need? We're not trying to necessarily cure something or look at it as like a disease or a condition that needs to be removed. We are trying to focus in on what supports does this person need to survive as they are. And it's a big mindset shift for a lot of the medical community in particular, but it's so important. to I making sure that we're not only taking into consideration what supports a person might need, but also the lived experience that they bring to this world. They're caregivers, the autistic individuals, the self advocates, parents in particular, that really matters in how we care for people.
Yes. I always have such great conversations with guests right before I press record. One of the things, I'll say two of the things that we were talking about were stigma and meeting people where they're at. So, what we want to do today is help remove that stigma that is associated with anybody who's neurodiverse, somebody who doesn't fit into the washer dryer setting of normal. I swear that's the only place where the word normal is in my life. It's on my washer or dryer. But having a developmental disability or a learning difference doesn't necessarily have a mark of shame. We have the opportunity to introduce this neuroaffirming care, which just means you're providing care to somebody who's neurodiverse, basically. Brittany, anything to add?
It's really important as we think about how we care for people, as you said, to meet them where they are, right? And so I'll give an example of kind of how I came to the Autism Society for some of the work that I was doing. I enrolled my son into early intervention, and this is something that a lot of people don't realize is that in most states, you can actually self refer your child into early intervention services to have the evaluation done, and that you don't actually have to have a referring provider in order to do that. Eventually, you will need them because if your child qualifies for services, you'll need prescriptions and things like that that they'll write for you. But along that process, we had a variety of different therapists that would come into our home, and they would make comments like, "Oh, we're so grateful that you have a sensory friendly home," or "You wouldn't believe how many parents are in denial or don't want to have their child evaluated or don't do XYZ, fill in the blank." And so, as a pharmacist who spent well over a decade in community practice and, working with patients on vaccine hesitancy or medication adherence or any number of things, I knew that there are a lot of reasons that impact somebody's willing to accept a particular service or to make a decision or a choice that impacts themselves and their care. And so I then started going, I want to better understand, the why. Why is it? Why are we experiencing this? Or what is it that people are missing? Are we missing education about the topic? Are we missing access to particular supports? Do we make it difficult? Do people not even know? And my son was diagnosed at 2.5 years old. We started early intervention at 18 months, for example. And what was interesting is that as I was shortly after we got his diagnosis, I started looking at, what are the organizations that are out there, who's available to help me with where I'm at with having just, had my child diagnosed and wanting to, learn more. And so I think that is really important to remember as we go, down this path of this conversation today, and not only just for autistic people, but anyone who's neurodiverse or just people in general, right? Is that it's really important to meet them where they are to provide care. Because if we don't, then we're assuming that what care we're providing is what they need instead of just asking someone, oftentimes just saying, "Hey, what can I do to help you?" Or "What do you need?" Or "What are your barriers?" is critical along the process and making people feel comfortable. If we just, write it off and act like it doesn't exist or don't ask the questions, curiosity is a clinical skill, then I think you're going to miss a lot, and potentially it's going to be really difficult for any, parent, a caregiver, an autistic person to feel comfortable even saying what they're experiencing or what they're dealing with. And so I think we have a huge opportunity in pharmacy because we see patients so frequently and so much more than a typical provider does in any given year.
I think it's going to be like developing a muscle almost.
Mhm.
developing the ability to provide neuroaffirming care because it's not something we've, I think, consciously stopped and thought about providing. But then once you see it, it's almost like the mom goggles commercial that I've seen. I don't know if you've ever seen that, Brittany, where there's a guy who's walking around and he sees some goggles and he puts them on and they're mom goggles. And once he's wearing the mom goggles, he can see piles of laundry, dishes that haven't been washed, and the bed that's not been made, and the note on the fridge that says pick Billy up at 3. You know, it's almost like we're hoping to give mom goggles to pharmacists so that they recognize that we can meet patients where they're at, and it just takes us pausing to ask them what that means to them so that we can meet their needs.
Yeah.
Love how you said meet them where they're at. And I love that you said curiosity is a clinical skill. I've never heard that before. Did you come up with that?
Maybe it just speaks to if, let's say, you're in the pharmacy or you're in a hospital, you're going to talk to a patient, you're at the counter, doing that counseling with a patient, using their name, right, is something so small, but something that can make someone truly feel seen and appreciated. And I think pharmacists, as a general practice, are pretty good at this. We, for the most part, get to know our patients very well and have that relationship. But even things like sensory awareness, too, right? If it's a small child, for example, do they have any difficulties with taste or texture? A lot of the medications for my kids, for example, are in liquid form because they can't swallow a pill or a capsule at this point. And so, as the pharmacist, asking that simple question can make a big difference in terms of what that looks like for me as a parent at home and trying to administer that medication. For many parents, across the board, I think that applies to too, right? But just taking the time to do that. And then I think the other big thing of, meeting people where they are, and I'll just say in terms of neuroaffirming care, especially, pharmacies are they're very busy, but I think it's really important for us to take that extra few minutes, that extra time, ask if you see something that doesn't make sense, in a prescription, for example, or you don't have the full picture of what's going on with that patient clinically. Be curious, ask the question. You never know where that person is as a parent. I could have, like, this could have been the fourth visit for the day for myself, right? Or I could have just been dealing with trying to even get access to this prescription that I'm bringing into the pharmacy today. And it likely took a visit with a specialist, maybe the pediatrician before that, and maybe it took an evaluation or something even more before that. And so I think that proactiveness and speaking up, being curious, asking questions can really make a big difference to really understand who your patient is and then meet them where they are with what they need.
What they need may look different based on age and verbal
Yeah.
ability and cognitive ability. I know that my son, Kraig, he needs a lot of help. He's 23 years old, nonverbal. He looks like he has an invisible disability, right? So he looks like a neurotypical person, but he very much has autism and needs a lot of support. But I think that one of my pearls of wisdom that I would like to pass on to pharmacists today is that it's okay to presume competence.
Mhm.
Presume that the person across from you is competent. But if there's a caregiver, which is me in this case, you also want to acknowledge that there's a caregiver. And if you, as the pharmacist, are not getting from the patient, which would be my son in this scenario, if you're not getting the acknowledgement that you need to be sure that he knows what's going on, then I think it's just fine to shift the gaze over to mom and say, "Who's with you today, Kraig?" or something like that. And then ask Kraig, "Is it okay if I talk to your mom about your medication?" Even if he doesn't really understand for sure what's going on or acknowledge it, I think he understands his name and I think he likes being talked to. I'm just telling you from my point of view.
Yeah.
And I think there's a lot of individuals who are unable to communicate effectively that would appreciate that same opportunity. So presume competence. Brittany, what do you have to say about competence?
I wholeheartedly agree. We talked about, stigma earlier in the conversation too. And because somebody is neurodivergent or has autism, it doesn't automatically mean that they have an intellectual disability as well. And so that assuming competence is really critical, especially until you get to know your patient better. And, maybe that first encounter, you're not sure. And I think, as you said, ensuring that our patients, we make sure that they have their agency is really important. And I would say the same thing for a parent of a young child, too, right? So in that case, it's a little bit different because we know that a minor isn't someone that you can actually truly counsel legally, right? You need to have a caregiver or a parent there, but you can still acknowledge the child or the adolescent and, talk to them. And I think that really helps them and their family, their caregiver, their parent, whomever, know that you see their kid and can go a long way in developing that relationship and especially that trusting relationship because as fragmented as things are across the healthcare system, the pharmacist interaction is probably one of the most stable relationships that people have across the healthcare system. And so that trust can really go a long way, and you earn it one encounter at a time along the way.
One of the things that I heard you say is that that child would feel seen if you acknowledge him or her. I think that's part of empathy, making someone feel seen, heard, respected, and understood. And that goes a long way to building trust. Yeah. And pharmacists have a great opportunity to build that trust.
Yeah, and they do it amazingly well across the country every single day with patients. And so I think that's one area where we really shine in the healthcare system of, doing the best that we can for our patients every single day. And this idea of neuroaffirming care is just going one or two layers deeper of what does that look like and how do you individualize it and tailor it to each patient and really going from efficiency to humanity. It takes a couple extra seconds to say somebody's name or ask them how their day is going or call that parent when there's a prior authorization that is needed to give them a heads up. Because I'll tell you one thing, I'm a very motivated parent, not just because I'm a pharmacist, but I will track down, I will call the doctor, I will do whatever I need to do to get it figured out for what my kid needs. And so, I think it's just important to try to be proactive when you can as well in the pharmacy setting to let, parents know because missing out on a particular medication or whatever it is, can really, really impact the experience and the quality of life of our kids.
Yeah, we want the patient and or the caregiver to get the medication that is needed for sure. I also want to make sure to bring up something that I'm sure you, of course, as a pharmacist know, but maybe younger pharmacists or students or technicians may not realize. I don't know how much people talk about the teach back method anymore. Although we want to make sure that they get the right drug, right dose, all the things. But once you give it to them, it's important that they know, even if it's a neurotypical person, how do you take that Medrol dose pack? How do you take that Z pack? How do you do that prednisone taper? There's a number of confusing medications out there. And even with neurotypical people, sometimes we ask, can you tell me how you're going to take that medication? Or you send them home with the vitamin B12 shot, and you want to make sure that they know that that multiple dose vial doesn't just stay good until there's no liquid left. It's only good for 30 days because it's, with the preservative and everything. But the first time they get it, they don't know. So sometimes you just want to check them a little bit. I
Yeah.
don't think you would be offending anybody at all in the neurodiverse community by asking them, could you please tell me how you're going to take this medication? And then I think if there's a caregiver in this situation, they would appreciate that too, because they know that they should be listening up to, and they can find out if their individual does know, in fact, how to take that medication. And if they don't, the caregiver should definitely be involved. So I think we have an opportunity as a pharmacist to make sure they get the right medication and they're going to take it, but also they know how to take it.
Absolutely. And I think what you're talking about really plugs in well to the patient care process. Obviously, we want to make sure that, like you said, right drug, right dose, right administration, all the things. But and we might ask the questions a little bit differently now, but assessing for understanding, I think, is critical because we can provide all the information in the world. But if our patients or caregivers, family members don't actually understand or comprehend what has been shared with them, then we, risk medication errors or readmissions to the hospital or somebody being harmed. And so I agree with you. I think as a parent, my pharmacy, they know I'm a pharmacist, so our encounters look a little bit different. One of my favorite things is when I get a student pharmacist that comes up and they counsel and just remembering, what it was like going through that and talking with the patients and wanting them to, know that I did my job well, but also that, they're going to be able to take this medication appropriately and call if you have any questions. But yeah, I think it's really, really important to making sure, especially if you have an adult like with your son, right? Where you might be counseling, someone might be counseling Kraig, but you also need, or another adult like your husband, for example, would need to be there to make sure that instructions are fully understood. And certainly in my kid's case, right? Mine are still toddlers at this point, so they would probably just give you a big smile and repeat something back, but there wouldn't really be any true comprehension there.
That would be so cute for a kiddo to say, "My mom's gonna give me 1 teaspoon on day 1 and then half a teaspoon every day for 4 days." I can just imagine the cute little voices. But anyways, yes, when they're adults, sometimes people do not understand their medications. So, when it comes to a neurodiverse individual who has a caregiver with them, such as myself, often I will have the pharmacist, they know that they need to say, "Hey, Craig, can I talk to your mom? I want to make sure she knows how you need to take this." And that's especially the example that I would use in a compounding pharmacy because my son, I don't mean to give out his, protected information here, but we have to go to a compounding pharmacy for a medication. And they know who is going to be taking the medication out of the dropper and putting it into the mouth. So yeah, I think it's okay to ask the individual for permission to talk directly to the caregiver. So put that in your bag of tricks as well, my pharmacist friends, that could work too.
One thing I forgot to mention that you just made me think of too is that so many medications for neurodiverse individuals are also used off label presently too. So using more open ended questions is also another way for you to better understand what they're using it for versus just assuming the typical indication for a medication. So I think that also is a critical piece to help you get more information so that you can better tailor that counseling and the education on top of it as well.
Yes, and that could lead to adding a new health condition to the patient's profile as well.
Yes.
So, a new medication for an off label indication could end up signaling a new health condition. So, put that health condition in the patient's profile. Now, what can we do to help patients by changing the environment if they maybe need a shot or maybe it's too noisy or the lights? Sometimes the lights are just too intense. What could pharmacists do to help with that sort of a thing?
Yeah, I think there's a number of things. And again, I just want to, caveat this that it's really going to look different depending on each individual person and, what their needs are. But, generalizing a little bit, some of those sensory issues, there can be light sensitivity, there can be auditory, so noise sensitivity, among other things. And if things are really, really busy, it can also be distracting in the area as well. So offering, to lower the lights, or if you have a consultation room, being able to offer a different space for someone can be really helpful. Turn down those lights in the consult room, or if somebody has headphones, letting them, wear those can be really helpful in the interactions and encounters that you're having. If you're in a really busy pharmacy and there's a lot of people around, a lot of talking going on, if you have another space that you could take a step to the side and so that it's a little less noisy or overstimulating, can make a really big difference for a lot of individuals. And just again, using that curiosity, not being afraid to ask if there's an accommodation that's needed, is really helpful and important.
I love all of that. One or two things that I would add is that this is especially true with my son when he was younger. He needed extra time to process information. He had about a 6-second delay in understanding what was asked of him, and he only could do the thing that was asked of him if it was a familiar activity or routine. So, the person that you're talking to, if you're a pharmacist and you have a neurodiverse individual, maybe somebody who has autism at your window there at the pharmacy, and they don't know the medication, they don't know the words that you're saying, and you're saying it too quickly, they may not understand. So, slow down, check to make sure that they are doing the thing you're asking them to do. Like show me the 5 mLs on this dropper, teach me, how you're going to use this medication. And that'll help you get a sense of if they're really comprehending what's going on. So I would say that this is just an adjustment that you may need to make, or it'll help you get more information about how they process information.
Yeah, I think that's a great example too. I have seen that with my son at times as well, where just needs a little bit of extra time. And so, not continuously asking a question. I think it's normal, right, for all of us to like ask a question and then we get uncomfortable with that silence if there isn't an immediate answer. And now I'm going back to my days of teaching student pharmacists and precepting, but just being okay with that silence for a minute and allowing that extra time, like you said, to think through the question, process it, come up with whatever their answer is going to be. Something unique too that, came up is that even how communication happens can look very different. And so, one of my kids has an AAC device, another one is more verbal, but is a Gestalt language processor. And so they learned language in chunks of words, and they can look very different, have different meanings depending on the person. So I think it's just helpful to be mindful of even communication can look a little bit different from person to person, and no one way is better than the other. But as a pharmacist, just being mindful of that and realizing that you might have to adapt your own style depending on the person and what their needs are, can go a long way. And especially if you have a caregiver or a parent or a family member there, oftentimes they're also willing to kind of help, jump in with the process to get there. I can't even tell you the number of times that, I've had to help, sort of translate for my own children as they've been learning in that communication process. And so we're aware, and I think it's just important to normalize that communication is okay in whatever form it is, and it may look different, but you can still, do your job to make sure that they're, understanding, or the caregiver is understanding, and that you feel good about the encounter afterwards, that they're going to be able to go home, take the medication, and get the benefit out of it that they're hoping for.
Great comments. I love that you brought up the communication device because my own son uses one. So he often has to respond by touching a picture, and the device speaks words. He still kind of has a little bit of a language delay when it's something that he's not familiar with, not a familiar routine, not a familiar activity. That's a really good point. And then I also wanted to bring up social stories. Have you had to use social stories with medicine with your own kids, or do you have experience with that with people that are neurodiverse?
We haven't had to use it for medicine yet, but we have had to use it for other important things in day to day, life, and they're a really helpful tool. And so I think for me, like with my oldest, if there's a concept that we're trying to, get through, or find a way that they're going to be able to better understand the information, a social story can be really helpful because we're putting the visual with the words. And that has shown to be really helpful for my child, specifically. And so we do utilize those for a number of different things in the house. And it's something that, he has taken to and feels comfortable with. And I think it's a great idea, a great example of how we can modify something small. I mean, I can create them myself, right? I can type something out on in a Word document, I can print it, laminate it, put some hole punches in it, and I can make a story out of it pretty easy. But it's the combination of the 2 things of that visual coming together with the words that oftentimes are helpful, or even sometimes just in, like, steps of, like, step 1, we do this with a picture, step 2, we do this with a picture, can be really helpful and just being open and mindful to it. For pharmacy, if you have a patient where you know that a social story might be helpful, it wouldn't be too difficult to create one and utilize that with them so that you could show them a picture of the medication and then you could show them the whatever they're going to use to administer it. And maybe it's if it's a pill and they're able to swallow, we have a glass of water saying, and our next thing we do is we take a sip of water and then we put our pill in our mouth. Really just some unique ways, and it almost feels silly saying innovative, but I know when I was in practice I didn't have the opportunity to use that, but certainly something that I would definitely consider now depending on the patient and their needs, and just being really open to different ways to help them understand and comprehend information in the pharmacy for sure.
I think you did a good job of explaining how you would do it. You would pair words and pictures, right?
Mhm.
And you would do a sequence of events from beginning to end. That's exactly what a social story is. And it helps an individual of any age, even neurotypical adults who are afraid of shots, to get comfortable with something that they don't do every single day. I honestly wish that there was something at the car dealership about, like just getting my car serviced. You come in, we're going to tell you 30 minutes, but it's really going to be 45. And then you're going to pay us money. And then we give you your keys back. Because sometimes I'm sitting there and I'm like, they told me 30 minutes. It's been 40. Now it's 42, 43. I got to go. Come on.
Yeah.
But, it causes anxiety when you don't know what's going to happen. And medicine's one of those things. So if a kid doesn't know what's going to happen when they're going to get a shot, or they've never taken a liquid antibiotic before, and they need those images paired with those words and the sequence from beginning to end. This sounds like a great intern project, Brittany. I'm telling you, some pharmacists out there, look up online what a social story is, create one for giving shots and giving liquid antibiotics, have it at the ready to give to your patients who are neurodiverse, or even your patients who are afraid of needles. It could help somebody. So that's a great project. Brittany, anything to add about social stories before we move on?
Um, yeah, I just can't understate how valuable they are and how helpful. So I completely agree with you. And you're mentioning the oral antibiotics. So I was just gonna throw out there like suggestions to help parents with masking the taste for those two. We live off of graham crackers in this house, and they're quite effective at coating the tongue, which helps mask the taste of anything that they might need to take. Another great, student project there is as well beyond, flavoring options that, are available out there. But there's a number of different tools that you can use to kind of help with that. And if it's something particularly struggling, I'll even bring out the Hershey syrup if I have to. There's a number of things that you can do to kind of help that process be easier, for parents that are trying to help their children or their adults for that matter, to administer, medications that don't taste so great.
I think we've made it through pretty much every sense so far. Taste, touch, sight, sound, smell. Maybe we haven't talked about smell yet, but you were just talking about the taste. And these are all things that pharmacists may not realize, that people can be overly sensitive, or what's the opposite of that? Undersensitive to certain
Mhm.
things. My son, when he was younger, fireworks right next to his head, off the back of a pickup truck didn't bother him. Now that he's older, he's a little bit afraid of the dark for some reason. So the sound of the firework paired with the darkness outside is a trigger for him. He just, gets really anxious. So as a pharmacist, there you go. Think about the senses and how, there may be something that you can do to help.
Yeah, absolutely.
What I'd like to do next is talk about how terminology and language matters. And as a medical writer, I mean, this is right up your alley. What are some of the words to use and what are some words to avoid?
I think this is such an important topic. And I have always felt very strongly about, how we use words, that words matter. I personally think that communication can be a bridge if it's done in the right way, or it can absolutely be a barrier, and it impacts how we show up for patients, how people perceive themselves, how they interact with others. And so it's really, really important. And I think I'll lead with, you hear me say autistic people. That's what I prefer, from having had many, many conversations with a number of autistic adults and just hearing and listening to their stories and what they prefer. And I think it comes back to that difference isn't deficient and that autistic people are whole, full stop. They deserve kindness, love, respect, dignity, all of the things. And so I have become very comfortable with that. Although I will say it was a little bit challenging at first for me because being a pharmacist, as probably was the same for you, you were taught, most likely to say a person with autism, right? Versus saying, autistic or a diabetic or fill in the blank. So it was quite a bit of a mind shift at first, but it really came from having those meaningful discussions with autistic people in the community. That said, though, I think it's really important to recognize that one isn't necessarily better or even fully preferred over one another. And so it's important to go with what the person prefers and to ask, right? And no one is perfect. We make mistakes out there, but we can do better and we can learn and continue that learning process and try to do, better for the next time. But leading with what the person prefers is always going to be the better route. Just kind of going on a soapbox for a second about, language. I know I was sharing with you before we started recording of an experience that I had this year. And it's a little bit challenging. Well, challenging probably isn't even the right word. It would definitely took me aback, and it's a difficult thing to share. So I'm just giving everyone a full warning ahead of talking about it. But so I have done my basic life support training every 2 years since I was in high school, before I even was a technician or a pharmacist. And it's always been a very routine process. You know what to expect. We do our didactic curriculum first for it, right? And then we go in and we do our skills testing. Except this time, when I went to go do my skills testing, we got to the pediatric section of it, and the trainer had instructed us to go and grab an infant mannequin. And there were two that were standard models and two that were non standard models. And the trainer felt it was necessary to call out that the two non standard ones looked different and said, so we're just going to call them alien babies. And, the room was just kind of, it was one of those awkward moments, but then proceeded to say, so we're just going to call them special needs. I can't tell you how awful that felt as a parent of an autistic child to have that type of dehumanizing language used, especially in a place that is supposed to be safe, that is all about every single person that was in that room, the healthcare professionals, their entire goal, right, is to save lives through CPR, regardless of gender, of ethnicity, of disability, fill in the blank. That is the whole goal of CPR, is to be able to save a person's life. And so my point in sharing this is that how we talk about things and what type of words we use, and how that in that moment was very much just a quip, a joke for that individual, but it has lasting impact. It's going to potentially show up in exam rooms, or impact how somebody perceives someone who has a disability or a difference, right? And so it's really important that we check those implicit biases. And that was a real world example of implicit bias coming into play. And not so much that we're necessarily making people feel bad about themselves, but that we have accountability for how we interact with one another, because it can cause real harm. And so, for me, I I was able to say something in an appropriate way that, acknowledged that what had happened was not okay and that, there needed to be definitely a change that would happen in the future related to that. But I think it's also important to not feel like you have to be silent when those things happen, and not that you have to go out and fight every single battle. I'm certainly not advocating for that either, because I do think it's really important to also protect your peace as, a parent, and to figure that out as an autistic individual. But in this case, it felt really important to me to make sure that there was accountability in that situation, and to drive home the point that it can cause real harm. And so, a long-winded answer and an example to share of what that looks like in the real world, and that was just me as the parent, right? My son fortunately didn't have to experience that, but it absolutely made me think and feel about what that's going to look like as he and other people in the autistic community, how they're experiencing life, and what those biases, how they impact them today, and then, the individuals across their lifespan and what that looks like and how we have to do better.
Good for you calling out that instructor for not using the right term. It's a child, even if it's not the same manufacturer of mannequin. That's such an awkward situation, but I love that you care about justice and getting it right for the people who consider themselves neurodiverse. It's a whole new world, and we're trying to just get it right for every person, no matter from which lens they look at life.
And especially as we're in, autism acceptance, autism awareness month, especially, right? I feel very strongly that awareness and acceptance is pretty passive. And in order for us to actually see change, we have to take action. Although speaking up in that instance, probably at the end of the day, isn't going to, in the broader scheme of things, change the world, right? But I do think that it makes a difference, on small increments. We can get to that point and where we really truly should be at belonging, right? So neurodiverse individuals, people with autism, autistic individuals bring value to this world as they and are incredibly innovative and really bring a lot to the workplace in different ways, think about things in a different way than neurotypicals do. And that is incredibly important to the world and to our interactions with each others and teams. And we don't all have to think, the same way. And so I think that that really is kind of the point, of everything, of true belonging, where it's just normalized that, people think in different ways and we all have different skill sets and different things that we can contribute. But how we make space for each other is something that we can control and be more intentional about, and more of that inclusion by design, so to speak.
Yes, I think inclusion is important because people with autism are not the only people among us who are neurodiverse or different in some way. There are some people who are missing a hand. I used to work with a pharmacy technician that was amazing at Toledo Hospital. He grew up in Cuba. He unfortunately had a firecracker in his hand. Hopefully, there's no kids that are listening to this that are getting ideas, but he closed his fist, and you know what happened. So he was a one handed technician and he was wonderful. But not only was he a brown person, but he was also missing a hand. And it's good for all of us to work and play and pray among people who do not look like us, do not sound like us, and know that they're different, but are still included. I think it's up to us to, if we see something, say something and include people anyway. Brittany, as we start to wrap this up, what pearl of wisdom can you share about individuals who are neurodiverse who come in from birth to old age? What's a couple of things that we could share with pharmacists about the spectrum of ages?
I think it really goes back to kind of what you and I were talking about earlier, that you can't make assumptions. Everybody's going to be different. their needs are going to be different, and that, it's really important to make sure that you're having those individualized conversations, that you're tailoring their care based on what they need and staying curious like we talked about before.
Thank you for saying that. Yeah, if you've met one person with autism or one neurodiverse person, you've met one neurodiverse person or one person with autism. Everybody's different. I think as long as we respect their personhood, then I think we're doing it right. And I think we have expressed a number of different tips for pharmacists and, pharmacy professionals in general to use, whether they're residents or students or technicians, owners, professors, anybody. I think we've started a conversation, Brittany, and I think it's up to
We have.
pharmacists. Yeah, it's up to pharmacists to put it to use. I'm looking forward to hearing people maybe send me a message and say, you know what, I learned something and I used it and you were right and it worked. And that person felt seen, heard, respected, understood, and well cared for.
Yeah. I just think it's so important how we impact, joy in people as well, right? And I think about, interactions that I've had with healthcare providers along the way and how it's made me feel comfortable or made me feel safe or made me feel like, okay, someone really understood what it was that was impacting me or what it is that I needed. And so, taking that extra minute, like we were talking about before, of moving from that efficiency to humanity is really, really critical to the process and going to make such a difference. So I hope you'll share those stories with me too, because I'd love to hear them and just love to, see how people are able to impact their own practice and the individuals that they're taking care of on a day basis.
I love that you used the word impact. I think pharmacists have a great opportunity to impact their patients. All right. Thank you so much for joining me today. Thanks for coming back to the show a few years later and sharing your words of wisdom. And good luck to you as you serve as an expert on the Autism Society of America's, what is it called? The
Panel of professional advisors and their national board. Yes. And thank you so much for having me. It has been such a pleasure to be here, especially during Autism Awareness Month, and just, wish you and your son the absolute best. And just thank you so much for the opportunity. It's been wonderful.
Yep, my best to your family as well. Thanks again for coming back to the Pharmacist Voice podcast. Take care.
Thanks.
That does it for my interview with Dr. Brittany Hoffmann-Eubanks. Thanks again to my guest for coming back to the show. At this time, what I'd like to do is review some of the takeaways that we dispensed today and then offer some advice for putting what you learned into practice. First, here's the takeaways. I have them numbered 1 through 7, but I think you could say that there's more than 7 takeaways here. I kind of grouped a few together. All right, let's get started with number 1. If you've met one person with autism, you have met one person with autism. Every person with autism is different. Number 2, curiosity is a clinical skill. I love this. It is so true. When you are curious, you get the information you need to have positive patient interactions. Number 3, presume competence, but verify understanding. Use tools like the teach back method, especially when a caregiver is involved, and tailor your patient counseling to meet your neurodiverse patient's needs. Which leads me to the next takeaway. Number 4, meet patients where they are across the board. That might mean slowing down during patient counseling, slow your rate of speech, adjust your communication style if needed. One thing we actually did not talk about during the interview is that some patients with autism don't do well with WH questions. Why are you taking this? What time will you take this? Instead, say, tell me when you'll take this. Sometimes people respond better to that communication style. Also, meeting people where they're at sometimes includes talking to a parent or caregiver instead of the individual. And then also be mindful of sensory needs like noise, light, taste, texture, and smell. Number 5, Social stories are a useful tool. I actually did a podcast episode about this. I think it's episode 332. I'll put a link to it in the show notes. With social stories, use pictures paired with statements to help patients learn about a shot or a medication before they experience it. Social stories are a useful tool. Number 6, language matters. Remember Brittany's story about the CPR mannequin? People with autism are people first. Don't objectify them or dehumanize them with language. And finally, number 7, pharmacists are consistent touch points, especially in our fragmented US healthcare system. We see neurodiverse patients more often than their primary care or specialty providers see them. You are a constant in someone's life. So think ability first. Think about what you can do. Think about what you can do as that constant in your patient's life. Get to know them a little bit more every time you see them. The next time you interact with a patient who might be neurodiverse or is for sure neurodiverse, just try doing one little thing differently. Maybe you can pause a little longer to verify understanding. Maybe you can ask one more question to help you understand what's important to them. Maybe try using their name if you don't usually address them by name. Try just one little thing next time you work with a neurodiverse patient and just see what happens. Those small moments may even save you time later on. They build trust. They prevent confusion. They reduce them calling you back later. And they help patients get it right the first time. The right drug, the right dose, the right patient, the right time. All the things. Help patients get it right the first time. If you're a busy pharmacist or tech listening to this and thinking, you just gave me more work, Kim, that is not my intention. All of these calls to action are not about slowing you down, they're about making your care more effective. I truly appreciate all you do. I've been there. I've been a pharmacist for 25 years. So I just want to make sure that you know I'm not trying to add more work to you. I'm just trying to help you make your care more effective. There you go. Now, if this episode resonated with you or you have any questions, I would love to hear from you. Send me a message through social media, like LinkedIn is my favorite, or use the contact form on my website, which is thepharmacistvoice.com. Tell me what you learned, or ask a question, or let me know how you've applied all this to your own practice. All right, and now let's switch gears here. As promised, I would like to share a brief update about my son, Kraig. Since my 2025 update about 1 year ago, my Autism Awareness and Acceptance Month episode update, Kraig has now graduated from high school, and we had an idea of how we wanted his days to look upon graduation. We wanted him to go to an adult day program, maybe 9 to 2 every day, Monday through Friday. So in theory, that was a good guess, but in practice, he didn't like any of the adult day programs that we tried. Theory and practice don't always match, and I think I actually published a podcast episode about that. Not autism related, but just somewhere in my back catalog. All of this is to say that he did not end up in a day program like we had planned. He would have done community outings and volunteering, gone out to eat, gone to parks, been with groups, etc. But instead of a day program and being in a group, we have caregivers part-time, and Kraig spends most of his days with me and my husband when the weekend comes. Craig's new schedule has cut into my work days, so I've slowly been stepping back from podcasting every week on the Pharmacist Voice podcast over the last year so I can help him live his best life. And in July, I'm ending my other podcast, the Perrysburg podcast, or maybe I'll go monthly with that. So, cutting back on podcasting has actually allowed me to continue to consult and coach and do other projects that I get paid for. One day, Craig's schedule might change, or he might decide mom is boring and make other choices. But for now, he is thriving at home. He's less anxious. He's happy. He's getting out into the community every day. In fact, I call him my Kraigaboo kangaroo because My house is like a pouch, and he jumps out into the community every day, and then he jumps back into the pouch, which is our house, and he enjoys being at home as well, watching movies, reading tons of books with me and my husband, watching YouTube on his iPad, and all the things that he enjoys doing. He gets to see family all the time, and I think he's living his best life, and that's our new normal for now. I have plans to update you more about Kraig during my summer 2026 update in July 2026. I just wanted to throw that quick update out there because these autism awareness episodes have a following. There are people that listen to these and not my other episodes. So I just wanted to give you a quick snapshot of where Kraig is in April 2026. If you've listened this far, thank you so much for listening all the way to the end. Let's wrap this episode up. Thank you so much for listening to the Pharmacist's Voice podcast, episode 369. The show notes are on thepharmacistvoice.com. In the show notes, you will find a link to Dr. Brittany Hoffmann-Eubanks on LinkedIn. You'll find a link to our other podcast episode, which was episode 127, published in December 2021. You'll find links to my other episodes on the topic of autism, a link to the Autism Society of America, my social media links, and much more. Everything you need is on thepharmacistvoice.com. Click the podcast tab and find episode 369. If you know a fellow pharmacy professional, pharmacist, student, tech, etc., who needs to hear this episode, please share it with them. And if you like this podcast, come on back. We've got more coming up here in 2026. Subscribe to or follow the Pharmacist's Voice podcast on your favorite podcast player and on YouTube so you never miss an episode. Thanks so much for listening today. I will talk to you next month. We'll be talking about drug pronunciations in May.